This conference will now be recorded.
Hello, everyone, and welcome to our ANCAN Blood Cancer Support Group. I am Michelle, and I'm in Boston and a chronic lymphocytic leukemia patient and advocate. I would love to hear from all of you, and I hope more people join us this evening. Judy, do you need any time this evening? If you could say where you are.
Well, I need a little bit of time.
Okay. All right. Barbel, hello, Germany.
I have a few questions for Linda.
I have some for you too, Barbel. Okay. And Mary, it's so good to see you, Mary.
Hi, I'm Mary from Michigan. I have multiple myeloma, and I'll say a few words.
Okay. Linda.
Muted.
Yep, there it is. Yep, I'll share.
Terrific. And Linda's in Connecticut. And Lynn, Mr. Texas.
I could probably give about 2 minutes worth of an update on a great meeting we had on Sunday, a meeting that Judy was at. So if
in person,
either Judy or I, one could share it. Yeah.
Nancy too?
Nancy wasn't there.
No, she wasn't.
We had about 50 people, including a CLL specialist.
Wow, that sounds really intriguing. I did not make it to Texas, by the way.
I was wondering because I didn't hear.
I meant to write to you, but yes, I ended up doing it virtually.
Oh.
So I know it was disappointing I didn't get to see you all in person. I was looking forward to meeting you and Lynn. That would have been awesome. But, you know, those days, it'll still happen. It'll still happen. So, all right. Well, I'm glad to see you all. Oh, Leslie is, yay. You're home. You're not in the hospital. Leslie, we're going to need to hear from you this evening. Absolutely. To update us on all that's been happening to you. But I'm going to start with Mary in Michigan.
Well, hello again. I've been missing the meetings. I'm starting to figure out that on Thursday after my Tuesday infusions, I'm pretty much wiped out. It's a bad day. But I really pushed myself today. I also went today and had my PET scan. I have that done every year because my lab work on my blood doesn't reflect what's going on with the myeloma accurately. So they do the PET scan to look deeper. So next month I might have some details on if they found anything. But that's all I had to say.
What infusion are you getting?
What infusion? I go every other Tuesday and get Kyprolis, and then basically once a month I get Darzalex. So, and they throw some Dex in there, so I just haven't been sleeping well either. So it's been a rough road for me lately.
Mary, how long have you been on this treatment?
I think it was 2023, so just over 2 years.
So is it indefinite or is there an end date?
Oh, no. Just keep going till it doesn't work, then get something else.
You sound like you might be a little tired.
Yeah, I really haven't been sleeping, and just been through a bad spell.
Does that happen every now and then?
Yeah, it does. It's usually like every 6 or 8 months or something. So
Oh, well,
just
thank
wait
you.
for it to pass.
So is it anything other than being fatigued or something that others can maybe here support you with?
No, I mean, this isn't my only disease. Everything else is happening in my life. And then I've only told 2 friends here that I have myeloma. One has a sister-in-law who has it, so she knows what it's about. But this other woman that I told, she took care of her husband with throat cancer for like 10 or 12 years. And then yesterday she told me that she's been diagnosed with breast cancer. That just really hit me hard. I don't know why, but so I'm getting over that too. I know it's worse for her than it is for me, but it just bothers me.
Well, yeah, it's certainly difficult enough with ourselves, right?
Right.
Others. Yeah, I feel like I'm more affected by others than myself. Does
I
that?
know. Well, they should be honored that she hadn't told anybody and she chose to tell me. But she knew I had cancer, so I could relate to it, I guess.
Yeah. Yeah, she probably thought that you were safe to share it with.
Right.
Does anyone else feel like it's really heavy? You're happy to help others, but that when you hear of more and more friends, does it feel weighty? So, Mary, what do you do to lift yourself up? Or maybe others can share what they do.
Well, I decided my new approach would be plan something to look forward to. So I planned an October trip by air. So who knows what's going to happen with that, with the federal government making their choices. And then I got another one planned for November. I thought that should do it pretty good, but now I'm getting nervous about it.
Oh, I think I'm hoping since I'm flying out tomorrow that things will run smoothly with flights, but yeah, fingers and toes crossed.
Oh, and then those 2 planes that crashed at LaGuardia. And of course, I'm flying Delta, and that's what they were. So get upset.
Yeah, that's concerning. Um, well, I know that it is concerning. Yeah, I'm not flying Delta tomorrow, so almost did, but it was too expensive.
Mary, I think I've seen some people that seem to withdraw from the interaction because after a while it does get overwhelming to them hearing other people's issues with their blood cancers or other type of cancers, and some folks just they need a break. They need to step away. And um, I just read a note in the last day or two. I think Judy saw it too. Somebody said, I just I enjoyed the get together we had on Sunday, but he said I'm just I'm not around as much because it's I need a break from talking about the disease. And I, when
Yeah.
especially um, I don't know, it's just it's there on our minds a lot, I think. But
Well, this woman has transported me for like my bone marrow biopsy and my some other things where I needed a driver. So I owe her. Yeah, and I love her because I've known her for 40 years. So it's just an adjustment. I didn't see it coming. It just threw me off.
I lost a friend last year, and he had follicular lymphoma, I think. but he had a really bizarre reaction to the treatment. And I see if I can even remember what it was. Johnson or Johnson-Stevens syndrome. And anyway, it was a reaction to some of the medication he got. And he died. It was a prolonged 6 weeks or so, but it just kind of rocked me that I had lost him. And he was young, 67, I think. And it was just, you kind of feel some survivor's guilt too. Why am I still here?
Oh, yes. That is definitely so. Especially when you see patients who are doing worse. That's also an incentive I had, because there were some young people who were very sick, and I thought they still have their whole life in front of them. That was an issue for me too.
It's difficult. I have a really close friend, like a 20, 30-year friend, and she's just went into hospice. She has ovarian cancer, and it's really, really difficult. It's and it's been tough for her, and she just can't do. And I had to respect her wishes. She can't do any more treatment. So, not that that's what we're all dealing with, but it gets to be a lot. And I just feel like, is this what happens when you get older? Just more and more people are getting sick, and this is happening? Because I keep hearing of more and more people. And someone in my family also was recently diagnosed with a different cancer. And it's just, it's hard. And they do share, because we all have cancer, right? And some of us here are advocates, or I know many of you are very active in support groups. I see you on them, and they do turn to us, and it is hard to ground yourself. So luckily,
I always change my focus. I listen, and then I look and try to think how I can help. If you focus on the relationship and, oh, she's gonna die and she's not feeling well, you start pitying yourself.
well, I had said that I would love to see you, but it's up to you. Whatever makes you feel better. If it would make you feel better, because it isn't, like you said, Barbara. That's a good point. It's not about us. It's about them. So whatever makes them feel happiest. So, but that's good to think about the relationship and and I guess the happy times, right? So that you are grounded.
Well, I was a nurse before. Maybe that's what makes a difference, I guess. Because I have quite some cancer patients among friends and relatives, which wasn't the case before, but now it is.
Think about my parents who lived 96 and 99.
Mine also 90.
And because of that, pretty much all of their friends were gone. And, it's just like, when you live that long, it happens.
Yeah, but cancer was relatively seldom. My father was almost healthy with 90. He just had a weak heart. That's why he died. But they didn't have cancer. And I think among his friends, there was one person who had cancer, skin cancer. But other than that, no, nobody had cancer. But now I already know at least 3 or 4 people who have cancer.
And people are living much longer than they used to. Heart disease took a lot of people out, and other diseases that they're curing or they're stabilizing, the diabetes, and now.
Yeah, but all my ancestors got around 90.
Well, Lynn, to your point, a lot of cancers are becoming chronic versus,
I think it's rising. environment, lifestyle, whatever. I think there are other reasons too.
Well,
Judy, I asked Dr. Wan that question on Sunday, if there was an increasing number of people with CLL, if there was something driving an increase. And I don't think, other than there was some discussion about Agent Orange and chemicals like that that people were exposed to. I think what he was saying, that people may be surviving longer. You have more people in the population with various kinds of cancer, but he didn't see that there was any type of dramatic increase.
Well,
Well, the problem
surviving,
is that he doesn't get everyone, because sometimes they just see a GP and they don't go to specialists, and maybe they're not even treated.
well,
They
there's,
still have CLL.
and then a lot of them are not identified as much either. I think we're having more.
Ones that aren't insured have an issue also.
Yeah, I was thinking particularly in earlier generations that they might have just been diagnosed with a blood cancer and and wasn't specified, or non-Hodgkin's lymphoma.
So Leslie asked a great question. Do you think, I don't know if people saw it, do you think that you find more people have cancer since you learned a cancer? It's a very provocative question, Leslie, and it's a great one. So why don't we come back to that question and actually go to Linda in Connecticut.
Hi, everybody. For one thing, I have laryngitis. I've missed the last 2 months because we had resumed a treatment that I had earlier in the year with the anacarin, or the Kineret. And after 2 weeks, it dropped my white blood count and my neutrophils so low that the laboratory doctor actually called to tell me that my numbers were way lower than what he had seen, and he had notified the doctors. So we had to stop the treatment again, and then I ended up in the emergency room, and they did a treatment with an IV treatment, and then sent me home. And then I made the decision. Mary, we were talking about like visiting people, and I'm in the collaborative cancer care group as well. And there was a woman that I had met in that group who was having a birthday party. So I made the decision to travel, and I came back with COVID. So on top of my numbers already being low, I have COVID. And that was, I had stayed grounded for so long. I was telling the oncologist today, I had stayed grounded for so long, for over a year, as we're trying to figure out treatments, what's working, what's not working. And right now, the decision is that everything that they've tried is not working. So after I get through, I need 2 weeks of being negative with no COVID, and we'll start the labs all over again, a series of labs, and then she's taking it to a tumor board for discussion to figure out what's going on. But my weight has dropped. I didn't think it was that much, but then today we were talking. So like I've lost 15 pounds since January. I have no appetite. I have minimal appetite because stuff doesn't taste right. And then of course having COVID didn't help matters much. The other concern is that since last year, since the diagnosis, I've ended up with 6 different infections that have lasted a significant amount of time. So the feeling is that there's something going on, but they just haven't nailed specifically what's going on.
So,
So that's
Linda,
where I am now. Mm-hmm.
Are you just more prone to infections due to what's wrong with you, or due to treatment? Because I know, for example, many of us here are immunocompromised due to our blood cancers, but also on top of that, many of the treatments in addition also immunocompromise us. So do you have that happening as well?
Right. She's feeling that may be part of it. because the treatments we tried early on, I had reactions to, but it didn't lower my numbers like the Kineret, just really just tanked my numbers. And because we're doing labs every week. So and then I'm neutropenia. And so the other issue is trying to figure out what's going to be the best treatment. And so the plan is, like I said, do all of these tests. My concern in discussion with her is that I've never had so many infections that just don't go away, that have lasted like this since I first got diagnosed last year. And the fact that, like, with getting COVID, and I was very careful when I was away, and I came back with COVID, and so now COVID is just added.
Judy has an idea for you or a question.
Has your doctor talked to you about getting IVIG?
No, she's talked to me about the it's called the white blood cell booster.
That's the Neupogen.
That's
Right.
Neulasta. Yeah.
Right. So we're discussing that right now. She doesn't want to do anything else. She's asking the doctors that are treating this syndrome not to do any treatments until they can run a series of blood work.
Well, IVIG is a immunological.
It's immunoglobulin.
Yeah, yeah, and also after you get over the COVID, you can't do it right after you have it, but close to it. Is ask her about Pemgarda. Pemgarda is kind of like IVIG for COVID, and it's kept up to date of the strands that are going around. So, and you get it like every 3 months. It's an infusion. And then the other one was I was going to ask, because I was sure that you were probably getting the Neupogen to do also, but I get all of those. So
Okay. Yeah, this has just been. I was frustrated when I got diagnosed with the COVID, because when I came back, I just wasn't feeling well for 2 days. Like something didn't feel right, and I had this like really weird headache, and I was just totally wiped out more than normal. And when I ran a fever, that's why I was like, let me go get this checked. And she did the test, and she didn't even get down the hall. She said it'd take about 10 minutes. She didn't even get out the hall. It came up immediately on the test that I had COVID. So they've been treating that with two different things, with the Paxlovid and one other medication. My PCP also recommended something. So now they're trying to make a decision, because it seems to have settled in my chest and my throat. I still have the raw throat. If they want to put me on an antibiotic or not. So that's kind of worrying.
What was the other thing they gave you?
It's
COVID.
Benazotate.
Was that going into an inhaler?
For the coughing.
Okay.
The congestion under control.
For the cough, then.
Right.
And how long were you on Paxlovid?
I was on a 5-day round. So I just finished it on Sunday, but I'm still testing positive. I did a test on Tuesday, and I did a test today. I'm still testing positive.
Did they talk to you about continuing your Paxlovid another course? That's not unusual. Could you ask them about that?
Yeah, I can ask my doctor about that. Okay.
And what Judy was suggesting, the IVIG would be for after this to boost your immunity.
Okay.
It's immunoglobulin.
And a lot of people that have lots of infections get it, and it helps them.
Okay.
How many people
It has high IgM, and if you have high IgM, you cannot have. That's what they told me.
If you have what? I didn't hear you, Barbell.
High IgM.
Is your IgM high, Linda?
It is.
Oh. But the other numbers, how were they?
My neutrophils were.
Oh no, I'm sorry. I mean the IG numbers, like the IgG, IgM, IG.
The IgG and the IgM were. Gosh, I'm trying to remember, because it had increased significantly even from when I had my bone marrow. I had a bone marrow in October of last year, and my IgMs were not getting better.
well, no, that so the IgM, although I don't want to say it doesn't have to do with your cancer, but it tests your immunity, not your cancer load.
Oh, okay.
So maybe that's something
I can
else.
ask her.
Yeah.
It would be
Okay.
they test for it specifically. But anyway, oh,
Okay.
so
Okay,
I don't
I
know if
see
that
it.
helps any.
Yeah.
Usually it's an IgG test that they give you. And if it's below, well, I get it if it's below 600. Some people, if it's below 500.
Yeah, Michelle started to ask a while ago how many people here get IVIG infusions. Anybody here ever had IVIG infusions?
Yes, I did
Okay.
that. I had it before, but now with the insulin, I cannot have it anymore.
I'm going to start in 2 weeks.
I fought for mine. I fought to get mine, and the PA, like I mentioned on chat, the PA came in and did another test because they said my IgG was fine. They did another test but broke it down into categories, and it showed that no, it was too low once they broke it into categories, on top of the regular tests for the IVIG, and that's what got me mine.
Yeah.
Because
Congratulations on
I
getting
had infection after infection after infection, just like you, Linda.
Yeah, Linda, it can be, you can receive it by IV in the arm, or you can do subdural, where you administer it to yourself, just a little small needle into the abdomen, and so.
I go for the infusions.
me too.
Yeah,
Yeah, I tried.
Cataract was the injections, and I'm over it. I'm just over injection.
It's bad
Judy,
enough getting Neupogen like that.
I wonder how different it is for the side effects if you get it with the injection instead of the infusion.
well, I don't know about injection, but it's subcutaneous. The other is a subcutaneous. It's like I
Right.
tried it and I did have reactions, and I don't to the
Did
infusion,
you? Okay.
but it's like, but that was me. It doesn't mean everyone. I don't know if maybe they used a different brand. I didn't ask. This is a long time ago, but it was almost like a belt. You're supposed to do it at home, like Judy said. It's almost like, but it reminded me of a belt. Did anybody try that? Or Lynn, did you ever see it? It's like a belt, and it has little. It sounds worse than it is. It has like little needles, kind of.
Really?
They kind of stick on, and you
Like,
just.
It's not just like a shot.
how long does it take?
It's
No,
not just like a shot?
no,
Oh.
no. You sit there, and it takes a. I don't remember. It takes a long time though.
Oh, I'll just do infusions.
If you live close enough, right? But I guess for people who don't, or I thought for traveling for work, I could keep my schedule and not change my work schedule, but not after I tried it twice and I had bad reactions. But that again,
Just
that was
moved
me,
them.
not
I moved them closer for the IVIG infusion. I get it right here near Dallas, and everything else I still go to Houston for.
so that's good that you get to have that there. How are you feeling, Leslie? You've gone through so much since in the
I
last
feel
month,
like
last few
crap.
weeks.
Thanks for asking. I feel like crap. Thank you for asking, though.
So do you want to share what you actually Linda, I'm so sorry. Let's finish with you before we jump to Leslie. But Leslie, you're next. Linda, so does this help any what people have said? And do you have anything else or any other questions for maybe some of the other things you're going through for people's advice?
Well, right now, I think the biggest thing that I just have to accept the fact that I just need to be very careful being out. Even though I'm good with a mask, I'm good about washing my hands and sanitizing everything. Um, I really thought that I could handle being away, and it didn't work. And so I'm a little frustrated with that. But I need to stay, at this point, I've got to stay healthy because I'm scheduled to have cataract surgery. at the end of the month. And so the doctor told me today is really going to depend on what my labs look like as to whether I shall sign off on me having it. And I have the cataracts as a result of the treatments from last year. So I'm kind of like in that caught state right now.
Did you wear a mask when you traveled or when you were away?
I did.
Wow.
I did.
And you still got sick?
I still got sick.
So sorry to hear that. That no wonder you're now tentative about traveling.
Yeah, it's like, I'm not gonna do it, but I really wanted to support this woman. Like I said, she's in my collaborative cancer care group on Mondays, and she's she's gone through a second round of treatments for breast cancer, and it was her birthday, and I just wanted to be there, just to kind of support
Oh, that's
because
so
she was
nice.
just feeling so bad. So I really just I wanted to go and just to support her. And she even said she was surprised to see, but she said that she was, I just don't want you to get sick. Thank you so much for coming. I had my mask on. Like I was really good on everything, but I still ended up getting sick. So, but I try to support people when I can, and that was my intent.
I wish I could tell you about how to not catch COVID other than I always travel with wearing a mask, using a straw under my mask if I'm thirsty when I fly.
I think Derek wants to make a comment.
Oh, Derek, hello. You snuck in there. Hello. Good to see you.
Hi, Michelle. Thank you, Lynn, for acknowledging that. Yeah, I mean, I came in late. Sorry, guys. I was over at the Men Speaking Freely group for a minute. But I had a question for Linda. How long have you been dealing with your MGUS diagnosis, Linda?
It's been a year. April. It was April of last year,
Okay.
2024.
The reason I ask is personally, I've been dealing with mine for about 17 years, since first diagnosed 17 years ago. And it's been a slow rise, fortunately, from based on my oncology reports and such. I've had a couple of bone marrow biopsies and such, and fortunately, it's just been a very, very slow ride. I'm just barely to the point of where my oncologist is calling it a smoldering multiple myeloma, not even a treatable or full blown multiple myeloma. So I hope that could give you a little bit of hope as far as longevity and such. And as far as you getting sick and stuff, I'm dealing with long COVID myself that I contracted back in May of this year. Yeah, and it hit me hard back in May where I had that razor blade sore throat version of it and such. And that was a very, very nasty ordeal. I did the Paxlovid, which was another ordeal in itself, having to deal with those side effects and such. But yeah, now dealing with the long-term COVID, which at this point I've been recently starting to address with herbs and supplements or natural supplements and such. Nattokinase, turmeric, um, a handful of others that my doctors have suggested, as well as upon research and reading about, have been using myself. And I'm actually now just starting to see some results that I feel that those have been attributing to. So just wanted to share that with you.
Thank you.
What do you
And
think?
yeah, and I think the other challenge, because I do a lot of natural herbs, but the other challenge is like the switch syndrome. Now they're feeling like the treatments that needs to be treated, and the treatments those aren't working either. And, so trying to find a doctor. They're looking for a doctor who actually specializes in treating such a syndrome to see if that would make a difference in terms of just feeling better,
You're speaking of
trying to feel better.
long haul COVID treatment?
No, I also have such a syndrome. So I have the MCUS and I have such a syndrome. So I've got two diseases and they kind of feed off each other. The
Right.
COVID, I was just diagnosed last week. So I'm hoping that symptom wise, that I'm not going to be a long hauler, that it was just a blow.
Good. Yeah,
Okay.
I hope so too, as well for you. But carrying MGUS, yes, you are immunocompromised. So yes, you must take all the precautions you can. Definitely.
My husband had MGUS for a long time too. Uh, it never really developed.
How long, Judy, did he have MGUS and it never developed?
Uh, more than 15 years. He
Derek, how
would,
long?
I'm going on 17 years myself.
I don't remember exactly. I just know that we saw a oncologist and he would get the blood tests once a year, unless they saw something, and occasionally he would get it twice a year that they would check it.
Yeah, I'm being tested, I think, every 6 months, as well as CT scans for my pancreatic cancer that I'm dealing with on top of it. Which, by the way, I want to report to the group that I just did have a clean CT regarding my pancreatic cancer, which I went through a Whipple surgery 4 years ago this September. So I'm very grateful and blessed that I'm still no evidence of disease regarding that side of it.
And I'm
Wow.
in a pancreatic study.
Did Eric?
I'm in.
Oh no, you're there. I thought you
I,
froze.
I'm sorry,
he
Judy,
said
what were you saying?
I'm in a pancreatic study through Brown University, which is being administered by UT Southwestern. They have an MRI uh, every year, sometimes twice a year if they see something. But so far, just lesions.
Okay, very good. Yeah, I started out with lesions myself as well, and the biopsies actually came back benign and negative on my lesions. But the surgeon convinced me to go through surgery, and once we got it to pathology, it came back stage 2A in the
Oh,
head and neck of my pancreas.
the other good news about pancreatic cancer in part of the study, because they just had to sign off with doing that when they're adding people. Now they're adding just a blood test. They have a new blood test that they're in clinical trial for checking if you have pancreatic cancer, which to me very promising.
Correct. I've been having some of those myself that my surgeon had ordered for me. Liquid biopsy is what they're referring to it as.
It's
That was all I got.
amazing.
Thanks, Michelle. Thanks, Lynn, for acknowledging.
So are you fatigued from long COVID, Derek? Is it fatigue
Yeah,
mostly?
fatigue, headache, the tingling on the skin, like pins and needles on the surface of my skin,
Huh.
uh, hyperphagia, I believe they call it, something to that effect. And then, yeah, no stamina, easily fatigued, shortness of breath as well, that comes and goes. Oh, and then I also am dealing with a sinus bradycardia, slow heart rate, which I believe may be attributed to the original catching of the COVID itself.
Wow. I have to say I never heard of the pins and needles, so it's not neuropathy, it's something different. And also
Correct.
and the low heartbeat, that's part of long COVID, or you had that, you said.
Well, I've always been bradycardia to a degree, but once I got COVID, I lost 10 more points on my beats per minute. I would normally sit around 48 beats per minute, which is low because they want you around 60. And now I'm down around 35, 38 since contracting COVID. Yeah, and I've seen cardiologists regarding it, and I'm luckily not having any symptoms based on it, such as fainting or dizziness or those types of issues. At which point, then the cardiologist says, "Well, then you're probably not really a candidate for a pacemaker at this point in time yet." We'll see. Hopefully, this long COVID eventually resolves itself, and maybe your heart rate will pick up those 10 points that I've lost over the last gosh, almost where are we at? 4 months now, 5 months.
But do you get to do any exercise?
Yes, I do. And I can to a limit, but again, easily fatigued. But you know what's interesting though, Judy, you mentioned that is at times when I don't feel like exercising and I push myself to, I actually feel better after I do the exercise.
Well, they say to fight fatigue with exercise, which sounds counterproductive, but works.
But it's true. It's very true. I will attest to that myself. Correct.
Yeah. Leslie, speaking of fatigue, Leslie is she's been in she's fatigued. She may not I just wanted to jump to her before she leaves. She was in the hospital earlier this week, last week too. I'm trying to remember when you started. Do you have a voice left to share? No.
You're
Yeah,
muted.
I'm getting the finger.
am I okay now?
Yes.
Can you hear me now? Okay. I went to MD Anderson for my appointments, and I was supposed to have a gastroenterology test done. I was supposed to have a breathing test done and see the pulmonologist. And on my way to that clinic, which is also where the heart doctor is, I ended up with a heart attack and um, sorry, ended up in the hospital. They did a left and right catheter um, and kept me for a few more days. And I got out and I stayed there over the weekend because I had to be seen again Tuesday by the regular oncologist. And so my husband came home, and about Sunday night, I started not feeling well again. And Monday, I went in and saw the skin doctor. Well, I look like a twister board because I'm allergic to glue from stickers that they put on you. So my whole torso looks like a twister board because everyone that came in to do any testing or anything wanted new stickers every time. So they wouldn't use the ones before. They had to have their own put in their own place. And then um, by Tuesday, I told the doctor, I don't feel good. I think you better check me for COVID because the emergency room down there was full of COVID. They put me in the hallway in the emergency room because I didn't have any beds. They tried to access my port as people were walking by. I told them, no, it's not going to happen. You are not accessing my port out here in the hallway. And so they took me into a little spot just off the corner um, and accessed it there. And then they did the COVID test and they tested for flu and all that in the one test. And it came out as rhinovirus, which is basically like a common cold. But I feel like crap and I'm just tired. It was a long week for me. And so that's all.
You had a tough week.
Oh,
Such a
bad.
tough week.
Leslie, did they do any stents in your heart? Was there blockage or?
No,
Um,
no. They said there was no blockage. They said it's all stress related.
I feel for you, Leslie. I too was hospitalized about 6 weeks ago because I came down with something on top of the long COVID and it just knocked me off my feet. They tested me for COVID, and at that time I was testing negative
Mm-hmm.
for actual live COVID at that point. But then I did have a nuclear test on the blood, and it did show that I was making antibodies for the COVID, which
Right.
did again affirm the long haul COVID and such. And
Yeah.
yes, I have been to the point where I felt so bent down and terrible about it that I'm just like, I'm so done with this that I can't deal with this anymore. And that's when I admitted myself, got to the ER, and then they admitted me because of the low heart rate was their main concern. did all those same tests. I saw a pulmonologist, I saw a cardiologist, I saw the oncologist, and they all came back and said, we can't find anything.
Right.
And I'm like, well, there's something there, because I'm certainly not myself. So I feel for you, Leslie. Definitely. You're not alone.
Yeah, that's pretty scary when they can't find anything. That must be pretty scary for you to have that
And heart wrenching.
happen.
Right. Yeah. And here you are paying all this money for them to do something. And yeah,
Well,
depressing.
yeah, they do call it practicing medicine. So,
I never thought of that.
yeah, I mean, well, if you think about it, they don't know about things until they find things, and then they research things, and then that's
You
how
must
they
be
find
patient.
out things are happening.
And while they practice, you must be patient, is the other key.
Right? That's right.
Leslie, how did they know you were having a heart attack? Was it when they were taking your vitals, or
Yeah, they took blood, and the blood test showed it.
that it was does that mean you've had others, or they
No, it had something to do with the D dimer and the,
Dimer troponin levels.
thank you, that's the word, troponin. Yeah. Yeah, because I didn't even know it until the next day when my husband said, well, the doctor said you had a mild heart attack. They didn't tell me, but there might be a reason for that, stress.
yeah, you think?
So, I mean, yeah. And when I went to the first night I went to check in at the hotel, and 5 minutes before we got there, a guy calls me and says, we're gonna have to put you up at a different hotel. We'll pay for it, but we're overbooked and your room is gonna be gone. And we went by the hotel because he said we're gonna send you an email to let you know. And I no email, and we were 5 minutes out. My husband said, "No, we're just gonna stop." And I walked in, and the guy at the counter had no idea what I was talking about. He said, "Your reservation's right here. Who called you?" And I said, "I don't know." He said he was from here. So he said, "Hang on." And he went into the back and checked. And the guy come out and he goes, "Oh." I said, "What are you talking about?" That guy right there said, "My reservation's right there on the computer. I'm set to check in at any time." And the guy looked dumbfounded, like, crap, she found out. So my husband seems to think it was because there was a wedding. They wanted to make more money than the medical discount.
Mm.
So he goes, "Well, you can have the room tomorrow," is what he said on the phone. So I'm glad I stopped because I never went anywhere. I stayed right there. And then I ended up being there 4 extra days. So, yeah, they made more money on me than the fact they were gonna, I guess. But I just that, and I just got done writing an email response back to the general manager. I said, well, the fact that I had a heart attack the next day didn't help with my stress levels having to deal with this at your hotel. I'm waiting to hear back from him.
Good for you for writing that.
So,
You so on top of everything, you had that too.
yeah, Michelle, you know me. If shit's gonna go wrong, it's gonna be me. But it's just, I've come to figure that life is life, and how you determine the reaction is how it's going to be for you. If you're going to have a bad reaction to something, then it's going to be a bad thing for you. You laugh about it, it's going to be a lot easier. So,
Yes. Don't laugh because it does not sound good.
yeah.
It sounds worse than a cold to me. Some
Yeah,
cold,
well, I've had this cough for 9 months.
that's the same cough. It sounds worse though.
But it is worse because I'm sick right now. So, but
Maybe
yeah,
this will kick it out.
what's that?
Maybe this will be the end of it. It'll like burn it out. Maybe.
Yeah, we can only hope.
Yeah. I know. Gosh. So what did they do so that you don't have another heart attack? Anything?
I have to lower my stress, and what's the favorite of all things? Lose weight.
Oh, they'd find something else if you lost weight.
Yeah, yeah. But that's always the answer for everything. But it's okay.
The day before I learned of your heart attack, my hair dresser, he had to cancel my last appointment. And when I went, I asked if I was like, is that okay? He had a heart attack. And I was like, what? And that was the day before I learned of yours. And I was just like, oh my gosh. And they went in, you said they went in through your groin. They went in through his wrist.
I have a friend they did that.
Yeah, they do that a lot. They were going to go through my neck, but I have the port, thank God.
But he did get a stent.
Yeah, yeah.
And
Yeah, I have congestive heart failure. And the fact that my it's diastolic congestive heart failure, and the fact that my muscle doesn't pump like it should, it's stiff, and so putting stress on that is not good for you. So it's just they'll have to figure out different meds for me or something. They did put me in a leash for 3 days.
a leash.
Yeah, Holter monitor.
Oh,
Yeah,
they're
I
awful.
called it my leash. Yeah, I've had many of them because I've had, up until MD Anderson, no doctor has ever figured out that I had congestive heart failure. So did it start because of the medications for cancer, or did I already have it and nobody ever figured it out?
Your heart monitor was smaller than the ones I've seen and
Yeah,
that I had. Was it smaller than others you've had, or that it seemed rather small in a good way though?
it was probably about this big. It went in a little leather case. The monitor was about this big, and it hung off and then it had all the big things all over the chest and stuff.
I just had one that was taped to my chest, and it was about the size of a quarter.
Yeah, oh no, not this one.
Yeah.
Yeah, I've had the old style ones that are about the size of a an old cell phone in a
Yeah,
leather.
that's kind of what this one was, that size. But yeah, I called it my leash. People will look at you funny when you're walking around with those things on. And then
Do
when
you
you put it under your shirt, it looks really funny. So I decided not to do that.
see? There's some humor right there. Do you have to go off your meds for this when all this happened, or are you still or not?
I have been off my meds since the 13th of July, but they've kept giving me the rituximab every other month. They gave it to me on Tuesday. Even though I'm sick, I still got the rituximab. So they've never
Oh,
stopped that for anything. I've continually gotten that. The Calquent, they told me to restart it, but I haven't done that yet because I'm sick and I don't want it to fight the illness. And I know that that's going to make it harder for me to get better. So I'd rather wait. If it's just rhinovirus, it lasts 3 to 7 days is the highest point, and then it'll take maybe 2 weeks to get rid of, but it'll calm down by now or by then, 3 to 5 days or something like that. I think he said. So I think I'm gonna wait until maybe Sunday to take it, just so it gives my body a little more time to heal from whatever this is.
You said you got an IVIG?
I did have that. The first one was last month, and I was due to have one on the 30th, and I didn't get to get it because I was down there getting my rituximab infusion instead.
Did they not go on and schedule it? Because you can take it like the next day.
Well, I did not, because I wouldn't have been here the next day to get it.
Okay.
Because it's a 5-hour drive one way from Houston to here.
Yeah.
And so, well, you're in Texas, Judy, right?
Yeah, I'm in Frisco.
You're in where?
Frisco.
Oh, okay, so you know it's a drive from Houston. So yeah, but I get it at Texas Oncology in Rockwall.
Okay.
But I think that's not going to be until probably next week either. I just want to get better because I got pretty sick from my IVIG.
Oh, really?
Yeah, we did it right before we went on vacation, and we drove and we got up into the higher altitudes, and I got really sick. I ended up in the emergency room then too. But it was
Well,
more like what put me in the emergency room down here. So
well, if you get into high altitudes, you probably had altitude sickness.
yeah,
I've had that once. That is not fun at all.
yeah. And we left, I think, just 7 days after my first ever IBIG. So my body was kind of
You think it was from that?
It probably
with
wasn't.
a combination.
It
What's
probably
that?
it probably wasn't from your IVIG
Yeah,
because the altitude can really do a number on you. I mean, I
yeah,
was not well until I came back down
yeah,
to sea level.
right. Well, with the heart condition,
You know,
the congestive heart failure, it makes it really hard up in the altitude like that. So,
heart condition probably played more with it than the IVIG.
yeah, they the emergency room in Salt Lake City would not give me anything for it. There is a prescription you can get for altitude sickness, but it messes with your red blood cells, and I think that was the reason why he didn't want to mess with it.
I had morphine which is not.
Oh, really? Oh, gee.
Yeah, I was deathly sick with it.
Um, well, Leslie, what are your next steps then? When do you, so is Rituxan your next move again, or do you have another appointment to check on you and your heart?
I have a phone call appointment about the 13th, I think, of October, and they're waiting for the Holter monitor test results before they just have me doing. I kind of started getting some of this issue when they doubled my medicine for my heart failure, and so I told him about that. So he cut that in half, and we're just gonna see what goes on.
Oh,
But we're done with me. Move on.
Hang
okay.
in there,
Well,
Leslie. Hang in there.
I
Oh, I
know.
will.
I'll check in on you.
I'm too evil to die.
Oh, stop it. Oh, I'm glad you're home finally. I know that you had to stay longer, so thank you for being here and sharing. Barbell, you have to get up early, so we need you to go.
Yeah.
Hi, Mary Lou. I forgot. I waved at you,
I
but
have to get up early and I have a cold too. And
oh,
yesterday I was also in the smear room, but it didn't take place because when you have Thursday, I already have Friday. So when I somehow thought, yesterday, Thursday, okay, the meeting, and I entered the smear room and Rick said, "You're wrong." Well, my problem is still the legs, because this IgM destroys the outer skin layer. It becomes dry, and then I get blisters, and sometimes it starts to bleed. So, but I don't have it anywhere. A little bit on the elbows, a little bit in the back, but not very much. It's mostly the legs, but it's very annoying. So now I have to see. I have some checkups coming up, and I hope the IgM is now in normal range at least. But the problem is it's still malfunctioning, and so I hope if the rash improves, I don't know. Did you see any improvements, Linda, when the IgM went down? No. Okay, so it's not the amount of tumor cells, but it's just the malfunctioning IgM that does this. That's what I wanted to know. And also, you do something with powder, right? Or what else do you do?
Right now, I'm not doing anything else. I was doing it's called pure protein, a pure protein powder. I was doing that to try to boost my protein levels up. It it works sometimes, sometimes it doesn't.
I have enough protein. That's not my issue. So, but against the rash, you don't do much. No.
Arbel, do you prop your feet up when you sit?
Sometimes, yeah, but I lay down sometimes. I like to lay on the couch. So I don't have feet, no swollen legs, nothing. And well, my skin looks a bit strange, on the legs, but it's mostly the lower legs, like the calves and the ankles. Above the ankles, it starts really. And somehow I think all the cancer cells went down in my feet. But I'm really kind of curious what's going to come, because I will have to call my other doctor, the GP who comes to my house, to have a test, and then I have a checkup at the clinic at the end of October. And I asked them to go through the tumor board again because of the dosing. Since it's very aggressive, I might have to stay on the whole doses, but I'm not sure if that's the case, because I heard also before that some go also off the BTKI, which I don't think happens in my case, but maybe they can adjust it more on a personal level. So I actually think then I won't have a rejection of the drug, because I don't like jumping from one drug to the next. And it's not clear yet when these mutations occur. They have studies for zoquetinib, which says the average is 18 months, but not for zanubrutinib. There are no studies yet. So it's unclear when these mutations occur, and it's also different in every case anyway. And so last time I already told the doctor, is that what you do, you adjust the dose when there is an adverse event. You get a heart problem, or you don't tolerate the drug or something, then you adjust the dose. But then I say it's too late, because then you already have these mutations in your blood cells. And I really want to avoid this. And there are possibilities nowadays with the new technology, with the AI, that they can do a more personal dosing. So we'll have to see. But I really want this, because I don't want these additional mutations. I have enough now with my 2 blood cancers. And I want the drug to work as long as possible. And it's pretty good, because I've seen some research now, and they really recommend Brukinsa very much, that it's even more effective than the other BTKIs. So we'll have to wait and see. It's always a challenge.
It is a challenge. It is too bad that before they don't know, but like you said, with the AI someday.
Yeah, they can do that, because in the meantime, they also can, with the Ki-67, which is the cell dividing factor, they can determine the aggressiveness of the disease, which I think is very helpful, because not all cells are good natured. Some of them are more aggressive, and I have the more aggressive kind. And if you know that, you can also choose the right treatment, maybe the right dosing. I mean, it all has consequences. When they find better diagnosis, better treatment. Oh, Nancy, hi.
Hey, Nancy. So, by the way, you two I know are in the writing group, right?
Yep.
Nancy and Barbell. Is anyone else in the writing group? No, Derek's not, but
No.
he shows up.
Rick was there the last time.
Can you tell everyone when it is? Because Rick also wrote to everyone about
Next week on Thursday.
Next
The
week,
same
what
time, we have the writing group. And it's really nice, because they all write something. And sometimes we have a short prompt where we write something with a few sentences, or we prepare something and we read it. And it's really nice.
So
it's a nice class.
Thursdays, once a month?
Yep. And next week is the next appointment. Next week, Thursday.
So second
What's the writing prompt for next week?
You can choose your own title this time. Before we had like, who's your superhero or something like that, but this time it's free. You can write whatever you want. You can also do some journaling during the week and read it. Some do poems. It's Nancy knows. Nancy is there too.
I went to one of them.
Yeah, you were there once too.
I would like to go again, but I always forget about it because I never put it on my calendar. And then there are the art classes.
I was in the art class also before, but yeah, but now I'm doing the writing class and do the blood cancer, and I have blood cancer uncensored is also a meeting, so I have some other things to do too. And the art class has the problem you have to get the what you know like paper and stuff to do the drawings and everything. So in the middle of the night it's kind of difficult. So.
I just found that the art class moved really, really slow.
Yeah, they are really good because I did it once and it came out really nice.
Very slow.
I didn't really expect it to work anyway because I didn't think I was talented enough. But it came out good.
Judy, did it change since we lost one of the members?
I just went the first couple of times when they started it, and I just found that I was anxious because it was going so slow. I wanted to go to the next step, and I know that there are some that it's for that have some, I think, some physical capabilities that they're not able to go as fast.
Yeah. I was telling Michelle, I usually catch it afterwards and just fast forward.
Yeah, it's also recorded on YouTube. Mm-hmm.
Yeah. I was wondering how it changed since we lost one of the members of ANCAN.
Oh, yeah, you're talking about Alexa.
Yeah.
Has anyone heard of her? No? Michelle, you're eating.
Does anybody go to the Women Speaking Freely group?
I've never been able to do that one.
No, I wasn't either. Yesterday was a snowflake group, and I have no idea what they were doing.
Did you say a snowflake group?
Bye, Derek.
A what group?
Snowflake group.
No.
I thought Barbara said there was a snowflake group. I was like, what is that?
That's exactly what I said too. And I looked at the faces and they don't look familiar.
Our CLL group is like
It's the vision group. The snow vision group.
Yeah, something with snow. I think it was snowflake. He said snowflake, I think.
Oh, it's the
because I asked Rick.
group,
I said,
and it has to do with. It has to do with people have like a vision disruption, and they call it Snow Something.
Oh, okay.
And that's the group it is. Yeah.
Ah, okay. Yeah, that is a bad thing. I had this too. I had uveitis on both eyes too, and I know what that is like.
Well,
Yeah, that's it. Because I had asked about that.
You can come
Yeah, I had eye issues too, especially before my first treatment was really bad. I had I had to put on some special glasses, with +5 or so to read something, which I have no reading issues. I have no glasses on now. So that was all the CLL. It all, but it went back to normal, so no problem. But it was not a good idea. If your eyes don't work, that is not a good idea.
Very well. Well, we wish you a lot of fun tomorrow today for you, later today for you with your family. You need to get some rest, Barbell. So if you want to jump off, I'm sure
No,
everyone.
it's okay. It's okay. I mean, it's anyway already past 3, so no problem.
Oh my gosh, you're amazing at all that. Mary Lou, hello.
Hi.
What's the state of? Are you in Massachusetts or Connecticut?
No, Massachusetts. Yeah. Tomorrow I'll be in Connecticut.
How are you doing?
Well, I feel guilty saying I'm doing fine.
You went
But I
off,
am.
didn't you go off one of your treatments last month?
I'm done with my chemo. I ended last Friday with the IV and Monday with the chemo pills.
Yeah.
So and my blood counts were all normal when I went on Tuesday, this past Tuesday. And he told me to go live my life. So I do have a biopsy coming up at the end of October. So yeah, I'm doing well.
Go live your life, meaning it's all gone?
No, well, he can't say I'm cured because it's always something may always be lingering. But I don't have to I don't have to be afraid to go out in public anymore.
That's terrific.
Yeah.
Wow.
Doing good.
That must be such a relief to hear that and be off of everything.
Yeah. With the summertime, it wasn't so bad because I could be out and about outside. But with winter coming, it's nice to know I can go to TJ Maxx. But yeah, I'm doing well.
That is so good to hear.
Yeah.
How long from start to finish was treatment?
It was 18 months of chemo. So I was glad to finish it.
That's a long time on chemo. I've done 6 months, 18 months.
Yeah, it's a long time. Well, it was a clinical trial. I could have stopped 8 months before, but it was a maintenance dose. So my local oncologist is Dana-Farber and their clinical trials. What is it? So I gave him the number. He said, go for it. In your case, I'd go for it. So I said, okay. I just wanted to run it by him, which he appreciated. So I did. I went for it. And it's done. I rang the bell.
They have a bell? I've never even seen a bell in there.
Not at Dana-Farber. This was at Bay State. I finished it at my local hospital. But they do have a bell at Dana-Farber. It's a hand bell, which is what I rang to.
Because mine has never gone. I never got to, when you're on pills, at the end of my FCR, I didn't ring anything. I mean, they didn't even bring me that little bell.
Yeah.
And at the end of obinutuzumab, I was nothing. So it's always anticlimactic. Judy, you understand. And Nancy, is anyone else here rung a bell or? Mary, you did. We have 2 bells.
I had some radiation treatments and they let me ring the bell. I thought, well, why not? I wasn't cured, but it was fun.
Oh, and Mary Lou, you got to, it must feel good.
Yes. It does.
Congratulations.
I'm still hesitant to having my port taken out, though. I'm going to leave it in a little while longer.
I've had mine 10 years and it's never coming out.
Okay, yeah.
Wow.
Yeah. Because I'll have to go for blood tests still.
Do they have to change it,
test.
Judy?
See, Judy, you can take it with you when you go.
For 10 years. Don't they take it out and put a new one in it?
No,
No?
as long as it's working. And I actually told my doctor, I said, if it stops working, you're putting another one in.
I never heard that. For 10 years. That's
Yeah.
awful long.
Well, I also get a blood test every month with it because they have to flush it. And so I said, you're not just
They
gonna
do.
stick me and flush it. You're going to take a blood test, which also keeps me on top of where I am. You know, if anything starts developing, we know it quickly.
Well, after 10 years, you would probably miss it anyway.
Really, it's right.
You don't even know it's there.
No.
So, Mary Lou, what are you doing to celebrate? Or what did you do?
We did nothing. We came home from Boston. No, we didn't do anything, you know. But we do have a trip planned, so that's good. We can go on a trip.
Oh,
Where are you going?
That's great.
Oh, we're going to go see the Ark. You know, that big Ark in Kentucky?
Yeah. Oh, yeah. My
Yeah.
brother's that.
Yeah. And we're going to a place called the Switzerland of America. It's in Sugar Creek, Ohio.
Yeah.
And then from there, we'll go to Kentucky. Yeah.
That'll
Something
be fun.
different. Yeah.
I can't wait
Usually
to hear
we take-
about it.
Yeah, it should be interesting. It's completely different than any trip we ever took before, so we'll see. Yeah.
Good night, Leslie. I hope you continue to get better.
Yeah.
Bye.
Good night, y'all. Thank you.
Good night. Good night, Leslie.
I'll try to sit up and sleep.
I'll get better.
Thank
you
you
can
very
sleep.
much.
Take care of yourself.
Thank
Mary Lou, you're going to love the Ark. That is the most incredible. It's just amazing. The imagination that they use to project what might have been, how they might have happened, how they might have fed the animals, all that. We loved it.
Did you? Yeah. Yeah. My husband was interested in seeing it. I said, what the heck? Sure.
If you like, it's very creative, and of course, just trying to keep it to, making it actual size. That is impressive, just to see what that size looks like.
Yeah. Was it 2 football fields? Is that what it is?
It's
Wow.
big. It's
Yeah.
big.
Yeah.
I'd love to see that.
Looking forward to it. Yeah.
Well, you'll have to let us know. When are you going?
October 26th.
Oh, so next time we see you.
I'm having my bone marrow biopsy on the 23rd. I've never had any problems with my bone marrow biopsy, so I'm praying that I don't, because we're leaving the following Sunday. So.
Hopefully the soreness will be gone too.
Yeah. I hope. I have sedation when they do it. I won't do it without sedation.
I agree wholeheartedly.
Yeah.
Well, our next meeting is the November 6th. So will you be back by then?
Yes, I will be.
Oh, good. So we can hear all about it.
Yeah. Yes.
That'll be exciting. So Judy, you told us about your excitement. How are you feeling?
I'm feeling okay. I've done 3 cycles of the brentuximab, and last week I started my venetoclax. This week I'm on the 2nd week of ramp up. I'm the 50 milligrams. I really, other than being tired, and when was it Leslie that was talking about the pins deal. When I was getting obinutuzumab, and I've done it for twice that I've had it, I've gotten it feels like pins are sticking you. That's the only reaction I've had. The last time they had only given me oral Benadryl the last time, and they stopped it for about 10 minutes, and the pins pricking kind of stopped, and then we decided to go on and give me IV Benadryl too, and that helped a little bit. It's not something you can't tolerate, but it's just annoying. It's just kind of like prickly. And I had that when I had my chemo. When I had chemo back in 2019, I had that same sensation of little prickles. But other than that, and I've felt pretty good. Um, I've still been going out. This week I have to have a doctor's appointment and 2 blood tests with every ramp up. So I do that next week. I'll also have my pentamidine breathing treatment on Monday. I get Pemgarda on Tuesday, and on Wednesday I get IVIG. So a week full.
A full schedule.
And start the 3rd week of ramp up too. The only thing on my blood, my hemoglobin is always kind of low, but my platelets went down to like 75. That's been the biggest thing, was the platelet level. And my neutrophils has stayed there, like this week were like 2.5, which as long as they're above 1, if they get down to 1, then I'll get the Neupogen shots. Those are already on order.
Just in case.
I need them.
Well, please keep me posted on how you're doing on all that. Now, Nancy, you were on venetoclax, I know. And I'm sorry, I've forgotten. Were you on obinutuzumab as well?
Yeah.
I thought so.
And acalabrutinib, right? And I'm on pirtobrutinib.
No.
So, did you, Nancy? Did you not do acalabrutinib?
No, I did the obinutuzumab and the Venclexta for the 1 year.
Okay, I was thinking you did the acalabrutinib too.
Mm-mm.
Mm-mm.
No, I think Elise did that. Elise is on.
Yes,
But the main thing that I found, Judy, with all of it, and still is just, I mean, the tiredness. I've never been able to figure out how to make that any better. But water, just and, and that's the thing. I just think it's so.
Yeah, I drink lots of water, and I've started adding an electrolyte.
Oh, that's good.
One of those, and that has helped. I haven't had hardly any cramping at all in my legs since I've done that. I just get some little tubes of flavor, like pour in my water. I do. It's flavored with fruit. I do put some stevia in it because I like it a little bit sweet. So, Lynn's back. Lynn, you're just in time because I didn't share yet on that on our meeting.
Oh, and Judy, I want to, since Lynn's back, I would love to hear, and after we hear from Nancy, I'd like to hear about the meeting you went to before we end our meeting. So, Lynn, thanks for coming back. But Judy, I mean, Nancy, we have all these Texans here. There are 3.
Well, and when Leslie was on, we had 4.
That's right. That's right.
Mm-hmm.
Gosh.
Just a great big state. No, I was at a clay class tonight, so I didn't think I was going to get on. My niece had asked me if we could do some art stuff together, and I have a friend who has a studio here, and she does different, like tonight we built mugs, and So it was mainly just to be with my niece, and so that ended. And thanks, Michele, for sending me a text, because I thought, oh, if they're still on, maybe I'll jump on. And so yeah, I go to see Dr. Wolf on the 28th, and I haven't had any blood work since May, so I really don't know anything, except that I was, in great shape in May, and I hope that that's still the case when I go in October. And just,
That's one of the few days I don't have an appointment.
I know, Judy, I was thinking when you were talking about being there, I was like, oh gosh, I wish we could coordinate our times together. And I think Lynn's going on the 15th. So
Well, the
we're not
20th is when I get a break for like a week and a half.
enjoy that. Enjoy that. So,
Nancy, don't take this personally, but what has happened to your Texas accent? It seems like it's been tainted by visiting the Northeast.
well, just ask me something Texan and it'll come back. Talk about cows and chickens and
He hadn't been home
eat.
long.
Can you still do the Texas two-step with Jay?
Yeah, we never were able to do that. We were of the talking heads era. We just jumped up and
Okay.
down and into each other.
I've done the Texas two-step. Come on, Nancy.
Well, if I have a good partner, I can do it. But Jay doesn't know how to do it. So it is. It is.
I saw who was the guy in Urban Cowboy doing the Texas two-step? Oh well, he was also in the movie Staying Alive too. Or
John Travolta?
yeah. Well, I guess I was supposed to give the update. Is that what you said, Judy?
Yeah,
Together we can update.
didn't get to that yet. And we missed Nancy. Didn't get to come. We missed having her there Sunday.
The party was a B plus. If she'd have been there, it would have been an A plus plus. So
Y'all are
it was
just
a great. It was a great experience. Dr. Awan, one of the dietitians spoke, but for me, Dr. Awan is a rock star. So I'll hang on every word he says. And he said when he came in 2019, they had 33 CLL patients, and they began to build their program. They currently have about 1,200 CLL patients. So they've increased from 33 to 1,200. And we had about 50 in attendance there, which was a combination of patients and caregivers. And some of them were brand new patients, just never had treatment, just been diagnosed in the last year. So I remember when I was in that situation, how much I hung on every word that the doctor said. And I think this holds true in any type of cancer. If you can go to a conference or sit in on a video call or conference, it is, for me, it was very encouraging and they were a very positive group.
Yeah,
So,
one of the things we did was we asked how long people had it and raised their hand. And we went from being diagnosed within the month all the way to over 20 years.
Wow.
Only one with that. Several of us had been.
George there? Was that George?
Yeah.
it was George.
Yep.
I think George was diagnosed about 2001, 2003, somewhere in there.
But anyway, we had one new member who came. He's 46 and has 5 children, and of course his wife came, and she was kind of scared. And I said, well, I hope this gave you hope, because you see people that 10 and 15, 20 years are surviving.
Judy sweet talked the doctor and got permission to use the meeting room. And so the meeting room was at UT Southwest, and all of the refreshments, we had wonderful refreshments, sandwiches and fruit and water, bottled water, soda pop, just, and it was all provided either by a benefactor or by UT Southwest. So,
Yeah. And this was the
and we're
first
gonna,
time we had met in 5.5 years in person.
Wow. And was this meeting the CLL Society or okay?
It's the DFW CLL Society support group, which
Yeah,
Dr. Awan is a great supporter and always has been since he came. He would I remember when we were meeting at La Madeleine's, and you had to have like a $25 deposit to hold the separate room. And so he used his UT Southwestern card and held the room for us with that. So he's been supporter from the very beginning of him coming. And when he was telling us, one of the things probably Lynn remembers too, he probably was, well, not probably, I know he was at Ohio when Dr. Kaufman was on starting the ibrutinib trial.
yeah, I think Dr. Awan was working for Dr. John Bird there
Right.
as they were doing the trial at that time.
Yeah.
Did you say Dr.?
Anyway, it was a great time, and it lasted from about 3 until 5:30. And Dr. Awan said, "I hope we can do this again."
Yeah.
And so we're anticipating do it again next year, maybe in the springtime.
Yeah.
That sounds like a great meeting. Did you say he started there in 2019?
Yes, he came. I think he came in September, and I was starting treatment in August of that year. So, and about 2 or 3 months into him being there is when the doctor I had turned me over to him.
Yeah,
that was when I was being treated for Richter's.
That's amazing how that practice has grown.
Yeah, I used to tell him, I said, I don't want to recommend too many. I'm having too hard getting an appointment. But he's really always people that come to our group, if they're seeing somebody else and want a second opinion, he's very kind for us to recommend to him, and he will get them in pretty soon. Because like I had a friend that has an appointment on October 16th, very, very quickly. Just good.
And Nancy, is your doctor in the same practice?
Right. Yeah.
She is. She's the up and coming, brilliant. She tries not to outshine Dr. Collins and Dr. Awan, but really she's the driving force.
She trained at UC and then went for her CLL training at Duke.
But she was the chief resident or whatever, the chief. She was the top at Duke.
Right.
Whatever. There's a name.
Dr. Wolf.
This
Fellow.
really.
And she was doing her fellowship there.
And she's young, so she's not. I'm likely to go before her.
Yeah.
So
She just had a new baby, and what's the other one? 2 or 3 years old.
Yeah, JJ is about two and a half, probably something. I think his birthday's in April, so we always talk about our kids. That's another thing. I love having a doctor where we just don't talk about my cancer the whole time. And that's my preference. I know other people are like, but it's so sweet to, like feel like we can have a conversation with her, and it's about real life and that. She's wonderful, Heather Wolf.
Not all doctors share all that.
No.
It dawned on me one day, I don't know, this is years ago. I didn't even know if my specialist, didn't even know if she had kids. I know she has a husband. Never even knew if she had kids because
Well,
she's all business, you know.
yeah, we shared with Dr. Juan. He has a son that's a freshman at UT in Austin, and has a daughter who'll graduate this next year and probably go to UT also.
No. It probably helps that Jay's a pediatrician, so she can get a little free advice on the side too.
That sounds like a good deal. Did you paint that painting behind you, Nancy?
I
I
did.
love
It's kind of a tree line, very abstract.
I love it.
Thank you. I like the colors. I just really, the colors make me so happy.
That's what I was just going to say, is happy. Can I commission you to paint me a happy painting to go over my desk?
We need to shoot me what that looks like, and then send me some thoughts about what you like. And yeah, I do things for people for sure. And if you,
Wow.
I mean, in fact, now I'm kind of at a place where I'd rather do stuff like that because I've kind of, I don't know, just sort of run out of ideas. I've painted everything I want to paint, really.
Well, Nancy, when's your next book coming out?
Well, actually, it's funny you say that, Lynn. I have joined another writing group besides the one that Barbell and I are in, and so my family we run a cow-calf operation in Texas, like right about 30 miles down the road. We don't live on the ranch. I have 3 siblings, and we run the ranch together, but we have a foreman on the ranch. And in 2027, our ranch will be what they call a heritage ranch, which means it will have been in our family for 100 years. And so I am writing a book. I am compiling stories and writing a book about the history of our ranch, because now there's 6 generations that have a stake. I mean, obviously, G1, G2, and G3 the very last G3 passed away this last week. So, but it's so, yes, I am actually doing some writing, and it's more historical than fiction.
Will there be illustrations?
I've actually have done paintings of the ranch. I did a show once that I had some cows, I had some cowboys, and I had my dad. So they're on my website. If anyone wants to look at it, nancycapra.com. It's super easy. You can go explore, and there's everything from abstract to cows.
We'll have to see that.
Yeah.
I love that history.
I'm sure it'll be interesting.
Yeah. The other thing, Michele, the other interview I had was for CME Outfitters, is for doctors training.
How are you getting that one? These are all so cool.
Yeah.
That's great.
That through CLL Society doing it too. Oh, Nancy, how was your trip to Chicago? She went to Chicago for Venetoclax.
I know.
So that was so much fun. I had a blast. It was a nightmare getting there, though. We left here at 8:30 in the morning, and we arrived in Chicago because I told him I wouldn't go without my husband, so he went with me. Thank goodness. But we got to our hotel in Chicago at 2 in the morning. And
oh no!
How come?
And so they were like the people who were, sort of staying in text with us as we traveled. We're like, we're so sorry, we can't believe this is happening, and it wasn't weather or anything. It was just bad American Airlines.
Oh crap! That's why I'm
But then,
flying tomorrow to Chicago.
but I had asked all these people to pray for me, and so I literally did not get irritated. Like I was at peace. I was kind. I was all that, and it just kind of hit me that these people were praying for me, and so it was like, man, that is working. And then I realized that the next day that I was going to be a testimony walking in the door, because I had had this horrible flight. And so I walk into the house where we're filming, and everybody's like, I'm so sorry. What a terrible day yesterday. And I can't believe. And I just laughed and I said, you know what? That was yesterday. And today is a great day. I am so happy to be here. And I had so much fun. At one point, the sound guy came up to me and he said, I need you to drop this mic down your shirt. And I said, I just stopped him right there. And I said, hey, I'm 65 years old. There are very few things in the world that happen in my life that are a first time ever. And I just want to take a stop in this moment and realize this is the first time I've ever dropped a mic down my shirt. So it was fun. They were so nice. The sweetest people. The drug company people were so kind. The technical people were so kind. My wardrobe makeup person was Jewish, and it was Rosh Hashanah. So I got to say Shana Tova to her. And I mean, it was so much fun. If anyone ever gets the chance, it was a blast. And I just told my
They did makeup for you. I didn't have them do makeup for me.
Thank you, Nancy. Thank you so much for doing that.
Yeah.
No, Michele, thank you.
It will help.
Which airline did you want to recommend us to take?
Delta.
Delta.
You want to take Delta. Don't take American. Except that if you're in Abilene like Lynn and I, it's the only airline you can take.
And Nancy, I wish you were there tomorrow and Saturday, because I'll be in Chicago and I'm flying American. So, and I never go to Chicago. That would have been great to see you all.
We didn't really go. I mean, we came out of the airport and we went to Highland Park. And that's where they had rented the house. And so we stayed at the courtyard there. And it was, we never really went into Chicago. And because of having just gotten back to Texas from Vermont, we really didn't want to extend our time. But it was a blast. It was a blast. I can't wait. If it comes out. And here's one more thing I'll tell you is they rented this house and they had me do different rooms in the house. They set up, and it was so professional. But then at one point they do this thing called your hero shot, like you finish treatment and you ring in the bell kind of thing, and they had chosen to take me over to this place called Rosewood Beach, and it's on Lake Michigan. And it's a sand beach, and it's got waves like crashing, like waves like the Gulf of Mexico waves coming in. It was so crazy. And I thought, if I had picked my spot like this, and they didn't ask me this at all, like this was, they had already chosen this, but if my spirit spot is the ocean and the beach, it was it was just things like that. I just felt like it was so much fun, and I'm not sure I'd ever do anything like that again, but it was fun.
You never know.
Michele, you need to come to Abilene in the springtime, and you can go with Nancy out for the roundup and the branding of the calves, etc.
Actually, we have roundup October 20th. If anybody would like to come work cattle, y'all just come on. Put you to work.
Do you rope cattle, Nancy?
No. No, I eat Mexican food. That's what I do. Our
Yeah,
foreman makes.
they have some Roundup delicatessens that you really want to try.
We don't do that. I know what you're talking about, Lynn. These people make all
Appetizers.
that kind of stuff.
I used to have a friend that did a roundup every May, and they did this huge skillets of fajitas and stuff, and breakfast with homemade biscuits and stuff. It was cool over the fire.
Oh yeah, our foreman's wife, her hot sauce, it's hot. It should cure cancer.
But it doesn't, huh? I'll try it.
I don't know. We could get a little clinical trial.
That sounds good. Yeah, I would love to do that. I've been to the Houston rodeo, so that's a start. But I have
We do roundup in October and May, so if anyone's in the neighborhood, I'd love to share that with you.
that would be so cool. Okay, I think we have a class trip, everyone, coming up. Maybe in May.
Or in the summertime, you can come to Vermont.
Oh, that's where I want to go.
Well, next year, I know we said this last year, but next year, I mean, on your way up or on your way down or somewhere in between, we have to meet up.
That'd
If
be
you're going to
fun.
be in Maryland.
Judy, we're going to stay next year till October. So if you want to come during like right now is peak like Jake is in Vermont closing camp. So
I saw pictures today on the news of Vermont. It was turning colors. Yeah.
Yeah. It's beautiful.
I would love to come.
I wanted to thank Linda and Mary Lou for indulging us to talk about some of our favorite things and our favorite doctors and so forth. I mean, come on over. You can join us on the CLL side.
Yeah. I wish you to have another disease, though.
You know, Leslie actually is in one of the CLL Facebook groups because in the beginning they thought she had CLL, and Judy, I think you may have seen her on it, or Barbell, but it's the darndest thing, and that everyone just loves her so much. You know, it's just like, yeah, you know, they were like, just stay on. So, because I mean, as you hear, she really uses humor a lot. And yeah, what else can you do, right? So she's a joy to have on there. But that's how we knew about all she'd been through. So anyway, it's great seeing you all. And next month, I'll see you on, what did I say, November 7th or 6th?
6th, I think she said.
November 6th, so we can hear about the ARC.
Yes.
We want a full reporting show. Please, like, have giant size pictures to hold up, videos.
There's a lovely book they have there that my brother bought there. It had all the pictures in there.
Ooh, that sounds pretty cool. And Linda, I hope by then you're feeling well and you'll be able to tell us if you can get immunoglobulin and if that you can for your drug with Paxlovid that you can go on. And I was on 4 courses in a row. Well, 4.5 actually. They finally let me finish during that last one. So it's whatever it takes, I guess, to get rid of it.
Yeah. Well, hopefully when you see me November 6th, I would have had one eye, the cataract removed. So that'll be hopefully.
You're gonna love that.
Yeah.
That is my favorite surgery ever. And then you can see.
As far as surgeries go.
It wasn't something I was looking forward to. It was just the treatments did it. So I hope that you're right. They already told me that. I'm still gonna have to wear prescription glasses though. Not
Really?
readers. I still wear prescription glasses.
That's too bad.
I know, that's what I said too. But I've been wearing glasses since I was in junior high school, so it's all right.
I
There are
have
some
mild
really cool classes.
vision with mine.
Well, it was great seeing you all. So I look forward to seeing
Michele,
you next month.
how's your vertigo? Did you tell us already? I'm just curious.
No, I'm so tired now. My vertigo. So the physical therapy is. I'm still in physical therapy, and So I asked about the lights. Did you tell me about the lights? Someone had told me they tested them with the goggles and the lights. They tested me with the goggles. They leave them on me for every physical therapy session. It's getting better. I went yesterday, and um, it's quicker to recover now. It doesn't last long, but I still have it.
Oh,
And it's only certain movements that's doing it. And yes, I sleep on the pillows, and Pilates, they have a wedge thing, but I had to stop Pilates for a while because I couldn't exercise within so many days of it. And that was always when I would be going. So now they have this wedge thing for pregnant women that I now use. Let them all talk, right? And wonder. I'm a miracle of science, but it holds your head up at the angle you're supposed to be at. So thank you for what you had suggested, because I asked about all these things because I didn't, they have to be more explicit than saying, oh, sleep on two pillows, like you had said, big pillows, little, squishy pillows, big fluffy pillows, angled which way. And she said some people can never sleep again on the side that they have the vertigo. And she's hoping I'm not that, because it's taking so long. But I had it so long it took so long to get in to see someone who knew what they were doing. So, but thank you for asking. But I am going to fly with it because I'm feeling better. That's why I didn't come to Texas, because I had a horrible day with it. It was just like I felt like right when I had first gotten it. So I just couldn't. It was like 2 days before. I was like, I just can't. This just would not work. And that's my pillow alarm. I usually have country and western music, so I guess you Texans are taking over for me and my music choices. Anyway, see you all next month, and also on text and DM and Facebook. So take care.
Adios, partner.
Thank you.
Hi.
Bye.